Hello, welcome to Revive and Rise, and I'm your host, Melody Parrish, and I want to thank you for choosing to spend your time with us today. I wanted to start a conversation about trauma and healthcare. The two are greatly intertwined, and we live in a country, the United States of America, that has a capitalistic view of healthcare. And it's complicated because we have money involved, insurance involved, and there are people that don't have insurance. And it's so complicated. What is all of this and what does it mean? Well, I don't understand everything about it, and I'm definitely not a financial guru when it comes to healthcare. But what I do know is that insurance is tied to employment most of the time. That's the way we can all afford it. And medical care in this country is astronomically expensive. And those two things right there create a terrible situation in which, those that are uninsured can experience great deals of trauma. So let's dive right into this conversation. I know I've experienced times when I think about when I have to go to the doctor or I have to go to the hospital or even if I have to get medications. And I'm often troubled, and I do stop and think. I have great medical coverage, but I do stop and think, do I really want to do that? Is that really something I want to do? Because it's going to be really expensive. And it's really sad when you have to think that way or feel that way. I do have good medical insurance, so I cannot begin to imagine what those in our uninsured population experience. And that uninsured population, that can be from any number of reasons. Mostly in this country, if you have health care or if you can afford health care, it's because it's tied to your employment. Um, if you're not employed, if you're not able to have to get a job that has benefits like that, some jobs don't offer insurance, medical insurance. And if you don't have that, then you're just out on your own. And that can be very scary. I think about people that have like severe healthcare conditions, like, high blood pressure, those that have had traumatic events like strokes, those that have been in accidents. Maybe they got a finger cut off or a arm or a leg cut off. There's so many diabetes, heart attacks. There's so many terrible situations that you can find yourself in. Or, if you do just have an accident of some sort, maybe you slip and fall down the stairs and break your back or something of that nature, something unexpected, but yet, you can't do anything about it. And if you try to do something about it, it's going to cost you thousands, if not tens of thousands, hundreds of thousands of dollars. And so what are you going to do? Again, you have to look at, am I going to put food on the table or am I going to take care of my physical health? And also, even things simply like going to the doctor, if you don't become proactive with your health care and do the proper screenings and take care of yourself, then you can end up in a very, very bad situation where you're just dealing with healthcare issues that could have been prevented if you had been able to take better care of yourself, such as high blood pressure, diabetes, obesity. There's so many diseases with such complications that we really can help and control if we just had the proper healthcare system. And I don't claim to know how to fix our healthcare system or what it is or what it would look like, but we just need to do better. I think about the people, parents, grandparents, other people that have loved ones that are in terminally ill or critically ill situations, and they can't help their children or their loved ones because there's no health care. And what about the parents that, the medical bills for their child being in the hospital keep coming in, or the children whose adult parents are in severe medical need, so they're put into hospitals. Those hospital bills keep piling up and piling in, and I'm sure they think, how am I going to pay? How am I going to do this? And it's so frustrating because watching people suffer like that, and I can't imagine what they're thinking, but I do know that the situation does get desperate. And even if you're talking about yourself, if you're in a situation where you're in constant pain and there's no way to get out of it, and you can't afford surgery, you can't afford things that would help to fix your situation, that's a problem. And for example, if you have a back situation, um, maybe a back injury, maybe you um, fell and severely hurt your back, um, and now you're spending the majority of your time either in pain or lying down in the bed because it just gets so excruciating. And when you hear things like, "Oh, your the surgery to help is going to be like $50,000, $150,000, all these astronomical numbers," and you're just like, you know, I I just make $15 an hour, $10 an hour. How am I going to be able to afford hundreds of thousands of dollars? Never. So I'll just have to suffer. You start to plummet into a state of desperation that's really hard to explain and it's hard to understand. But those places can lead you to different thoughts, different ideas, and to do things that you wouldn't normally do or you wouldn't even think about. Desperation is a terrible, terrible place to be in. I know I've experienced desperation in significant ways, and I know many, 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 many other people have as well. Um, so I think about if I was in that situation, um, and people know my history. I am just very thankful that I have been able to, be able to afford the health care that I have been provided, because I wouldn't be in the situation that I am now if I wasn't able to. And I think a lot of people can kind of understand that. I think my situation was definitely significant. I mean, with my car accident, I couldn't walk or talk or do anything for myself. So all of those services had to be provided either through a hospital or through an outpatient program for a while. And I think about people that can't afford that and can't afford that health care. And to say that health care is a luxury just breaks my heart, to think about other people that would not be able to do that. It just really breaks my heart. And in thinking about my situation with the PTSD, I know beyond any doubt if I was not able to go to a therapist to deal with these issues that I'm having, I would not be here today. I know that. And you think about so many people in this country that are dealing with other mental struggles, maybe not PTSD, but other things that affect them mentally and challenges that they have mentally, and they can't afford the proper health care that they need for their minds. And it just breaks my heart that these services are present. They're just not available to everyone. And the trauma that can cause and the pain and suffering that can cause, we need to stop and think about that. To be told that even if you do have insurance, to be told that, oh, well, we can't treat that or pay for your treatment of this because of a pre-existing condition. You know, how horrible, how horrible. And what do you think? Now I have to live with this. Now I'm going to have to find a way to suffer through this. And not just that, but you have to find a way to take care of your family and to provide for your family, because in spite of your pain, your family has to eat. In spite of your pain, your family has to survive. And so all of this pressure and all of this pain complicates things. And we hear about the recent news of the CEO of United Health. And, a lot of us are so critical, Oh my God, I can't believe he did that. Oh, wow, I can't believe that happened. But you know what? If you stop and think, I am in no way condoning violence. I don't condone violence in any situation. But condoning it and acknowledging it is two different things. And I look at that situation and I can totally empathize with the person that did the shooting, because how desperate and what kind of mental state were they in when that happened? How many times had they been told no? How many times had they been told, we can't help you? There's nothing that can be done. And what pain and frustration were they having to face about taking care of their families, about helping their loved ones, about their quality of life? So I'm not condoning it in any way, but I'm just simply stating that that person must have been in a very, very desperate state. And that's what's going around, and that's what we need to address. We need to address the desperation that all Americans are in this country. People are hurting, people are confused, and it's not just those simple things that happen. It's the subconscious, subliminal messages that these kinds of things send us. If you reach out for help and you're told no every time, then you get the idea of why bother? Nobody's going to help me. Why bother asking? I must not be important. I'm not important. Nobody cares about me. And you get those ideas stuck in your head, and they become like a loop. It becomes like a loop that keeps repeating itself. Keeps repeating yourself to yourself. I don't matter. Look, I'm obviously not important because I can't even get proper health care. No one cares about me because here I am suffering and no one will help me. And, those turn into even greater situations when, we actually think about those kinds of things and we start to believe those things about ourselves. We're never going to ask for help anymore because nobody will give it to us. We're never going to think that we're important or valued anymore because nobody cares that we're hurting. Nobody cares that we're suffering. So it just compounds itself. And those that are left are just left in a severe state of trauma and desperation. And so I just want us to take a moment, throughout the day and just think about these kinds of things and these problems that other people are having, and just recognize that these people are people too. These are people with families and loved ones, ideas, beliefs, wants, desires, and they matter too. They're just as important as any other person. And our job as human beings, our job is to care for each other and to help each other. And I don't know what the solution is to this problem, but I do know that it's a broken system. Our healthcare is a broken system that needs to be fixed. So I want to thank you for taking your time and just listening to our podcast today. And I hope you have a great day. And just remember that we are on this journey together and that you do not have to suffer alone. Bye.